The vision, a world where all people live free of the burden of drug abuse. This is the Drug-Free America Foundation's Pathway to Prevention podcast, where we are committed to developing strategies that prevent drug use and promote sustained recovery. Thank you for not only tuning in, but your continued support and efforts to help make this world a better place. We hope you enjoy this episode. Okay, listeners, have I got some news for you? Turn up your volume. Make sure you don't miss this. But I got to tell you, teen drug use is not inevitable. Teens and the adults that care about them need to know that the one choice of no use of any alcohol, nicotine, marijuana, or other drugs is a realistic goal, and that many teens are already making that choice. A study led by the Institute for Behavioral Health analyzed data from the Monitoring the Future study showing for 3 decades now, there's been a growing percentage of 8th, 10th, and 12th graders that have made one choice. There's even more updated studies as recent as November 2020 showing this impressive trend is continuing. Just a couple quick numbers. 59% have not used any alcohol, marijuana, cigarettes, or other drugs in the past month. 59% have not. 31% have not used any substances in their lifetime. I am honored to bring you my guest today. They are reframing the goal of substance use prevention as one choice. No use of any alcohol, nicotine, marijuana, or other drugs by youth under the age of 21 for reasons of health. But without further ado, like I said, I am incredibly honored to welcome Dr. Robert DuPont and Dr. Caroline DuPont to the podcast. Welcome.
Thank you very much, Dave.
Thank you so much for having us.
It is an absolute honor. And I just had to start out the episode with the positive about so many youth that are making this one choice. But before we unpack what is one choice, would you mind sharing a little bit about yourselves for our global audience that's listening?
Well, I can start off. I'm Dr. Robert DuPont, and I've been a leader in the drug prevention field and treatment field for 52 years. And it includes being the first director of the National Institute on Drug Abuse and the second White House drug czar. And it's been my privilege to be in this field, and I'm just delighted about it. We created a nonprofit organization more than 40 years ago to promote both prevention and treatment. And I'm the president, and Caroline is the vice president. So we're happy to be with you and very proud to be part of this from the Drug-Free America Foundation, which I have tremendous respect for and appreciation for.
Yes, and hello, I'm Dr. Caroline DuPont. I'm board certified in psychiatry and addiction medicine, and I am happy to say that Bob DuPont is my father. And so when I say I've grown up in prevention and substance use treatment, that's what I've done. And it's been really, it's an exciting thing to love the work that you do. So we at the Institute for Behavior and Health study substance use across the spectrum for prevention through treatment, and we enjoy all aspects of it. But I have to say my very favorite thing is prevention. So this is a topic that is near and dear to my heart.
I am in awe of just how much wisdom is in the recording studio with me today. I wish we had an unlimited amount of time so I could learn from you both. But yes, let's get into it. What do you say? Let's just jump right into one choice. What is one choice?
Yeah, one choice is something that we came up with IBH over time as we looked at our prevention data, and we thought, what are we actually seeing here? And we realized we were seeing some things that were actually really exciting. And so we're going to show you data that supports the idea of one choice that are 3 big ideas. First, that the developing brain is uniquely vulnerable to substance use and to other traumas. Second, that for teens, all substance use is related. So it's best not to talk about substance specific, but to think about substance use in general. And third, that trend that you were talking about of that growing number of teens that are choosing not to use any substances. But first, we're going to talk about kind of the basics here.
Way to think about this is that we're denormalizing youth drug use. For decades, there's been an assumption that it's a normal part of growing up to try drugs. That's part of being a teenager. That's part of learning for yourself. And that has been a crazy idea all along. But the new data that we're talking about, we're going to present to you today, shows just how wrong that is. But it would be a little bit like normalizing not wearing seatbelts and saying what we want to have is kids figure out for themselves whether they need a seatbelt or not. And if you tried to do that, what do you think they'd find? You would think that was crazy, but people would say that's a dumb thing to do. We know the standard is. Well, so what One Choice is a new health standard, and it grows out of the changes that have been made in the last 4 decades by American youth themselves. The leaders of this are the youth, and we're catching up with that and want to encourage other people to get into the idea of normalizing not using, just the way we normalize wearing seatbelts.
It can be important just to think about what is a drug? What are we actually talking about when we talk about drugs? And drugs are chemicals that impact our brains in a way that hijacks the pleasure center of our brain, the part of our brain that normally is there to get us to do activities like eating and sex and other pleasure activities that are for promotion of the species. And these chemicals are things that may be naturally occurring, but now they've been manipulated by humans and made more and more powerful and have larger and larger impacts on our human brains. And so when we talk about any of these substances, they all have that commonality, that common pathway. And so we like to kind of think about drugs as being alcohol, nicotine, marijuana, opioids, stimulants, any of those drugs. And it's important to make sure we're all talking about the same thing, because sometimes people will be like, oh, I didn't think about alcohol as a drug. I think that's different because we say alcohol and other drugs a lot of times as a phrase. Or I don't really think nicotine's a drug, do you? And now we have people that are kind of questioning, like, is marijuana a drug? And we want to just talk about from brain science, they're all related. So our One Choice message is just this comprehensive, no use of any alcohol, marijuana, nicotine, or other drugs under the age of 21 for reasons of health. And so as I just explained, we list out those things to make sure we're all on the same page. If you want to say, why don't you just say drug-free? I'm all for that. I love drug-free, but it's important to make sure that we're all saying the same thing. The second component of this One Choice is the health standard that Bob was talking about. We have a lot of health standards we talk to young people about that we're really comfortable with. We talk about it all the time, like always wear your bike helmet, wear your seatbelt, eat healthy food. And we don't kind of hesitate to have those standards because they're based in science, because there's a lot of data that shows that those things are important. And it turns out we have also a lot of data and science that shows that it's really important for youth not to use any of those substances during the time that their brain is developing. So the first component of One Choice is this developing brain. And the developing brain is something that is continually developing from birth through about the mid-20s. And if I could show you this slide in person, I would love it because it's so beautiful. And maybe you've seen it, slides that show that the brain is, many different parts of it are continuing to develop and grow and change. And that means that anything that happens to that brain during those years can have like a really big negative impact on that person. And so if you're worried about the present, like right now it could harm them, but it could also harm them in their future in terms of their future well-being, for example, their educational attainment or their future career even. And so we think about brain protection when we think about concussion protocols, but we also can think about it in terms of substance use, which also can really powerfully impact that developing brain.
So I got to tell you, a couple things that have jumped out at me already from this conversation is, framing prevention as that new health standard, coming at it from that angle. Like this is about health, not about norms or fitting in perceived norms, misperceptions. It's just a health standard that's based on data. I love that. And you had pointed out too that youth are already making this choice. They're already leading this effort establishing one choice as a health standard.
I want to go back to also to what we were talking about, because when Caroline outlined what we're talking about no use of alcohol, nicotine, marijuana, and other drugs for reasons of health until the age of 21. And everybody uses, as Caroline said, the drug-free, but they don't specify what it is, and they don't specify that age. And they don't do those things because they don't want to run into the conflicts that are there. They want to have an easier path. We haven't picked the easier path. We've picked the harder path, the clearer path, the one that's unambiguous. And a lot of people in prevention have gotten along for a long time. They'll say that just delay the onset. The goal of prevention is to delay the onset. Well, what does that mean? From 13 to 14? What are we talking about? The use of it. And so what we've done is sort of go right at the heart and say, no, it's all one thing. And it does have to do with 21. It's not 18. It's not 16. It's 21.
And I think that 21 is really interesting because 21 comes from where it's legal, right? All of these substances are illegal under the ages of 21. So that's the law. Sometimes people are a little confused by that because people will say to me things like, well, marijuana is legal in my state now. And I'm like, yeah, it's not legal for recreational use under the age of 21. It wasn't a carte blanche, illegal for everything and for everyone. And that age 21 is really helpful. It matches very well with the brain development that I was talking about. The brain development actually might set that age at 25 because that brain will continue to develop. But 21 is the law, and it's a good one for us to stick with and to say, if we can protect that brain until the age of 21, that is a really healthy thing for this person. The other thing I wanted to say about that health standard point, which I think is really important, is a health standard is not a purity test. It's not like I didn't wear my bike helmet today, so I can't wear my bike helmet tomorrow. Well, that makes no sense at all. Of course, you can always choose to do a healthy thing. And I think a lot of us adults can think about like how many times we've reinvigorated our health goals, like I'm going to exercise regularly or I'm going to eat healthier foods. That's a process. A health standard is a process of trying to improve and protect ourselves and to protect our health for the future. And that's the way this is as well, so that someone who might have used in the past could still make the choice not to use now for reasons of health in order to protect that developing brain. And so what we're giving them is the information about the developing brain so that people can make healthy choices to protect themselves. Because we can tell kids all the information in the world, but at some point, they're out in the world themselves. They're with their friends. They're at a party. They're in an unexpected situation, and they're going to be offered something or have the opportunity to use something. And they have to already have some core information about how to handle a situation like that. You're not there with them. You as the parent or as their teacher or their physician or whoever the well-meaning adult you are in that kid's life, you're not with them when they need to make that choice for themselves. And so them thinking, I'm going to always wear my seatbelt. I'm going to wear my bike helmet, even though rental scooters, don't come with them. I'm not going to make that choice. Or I'm going to choose not to use any of these substances because I'm protecting my brain. Another way to think about this is that substance use disorders are actually pediatric onset diseases. So when we talk about prevention, I often kind of stop people and say, wait, what are we trying to prevent? And different people are trying to prevent different things. Some people are trying to prevent overdoses, and some people are trying to prevent road deaths from alcohol use or drugged driving. But often people are trying to prevent substance use disorders. And we think about substance use disorders usually as adult illnesses. But in fact, 9 out of 10 people with substance use disorder will start using substances before the age of 18. And sadly, usually like way before the age of 18. And we have really important data that shows that the earlier the use and also the more the use is, the more likely it is that that person will develop a substance use disorder and also have other bad outcomes. And I mentioned that before, that early substance use is associated with things like poor educational attainment, and that's going to have a lifelong impact on that person. When we talk about one choice, you might be wondering, why is it called that? We haven't really focused on that, what that means yet. And what we mean by that is that for teens, all substance use is related. And really what it boils down to is a choice whether to be someone who chooses to use drugs or chooses not to use drugs. And the way we figured that out was by looking at this big national data. We looked at the data from the National Survey on Drug Use and Health. This is nationally collected data that's communities all across the country. They looked at 17,000 youth from the ages of 12 to 17, and they collect lots and lots of data. That's not our data, but that data is available for other people to use. And the Institute for Behavior and Health looked at that data and asked of that data a different question. And we asked a question that hadn't been looked at before. We asked, is the use of one substance by adolescents associated with the increased risk for using any other substance, regardless of sequence? So if you use one drug, are you likely to use other drugs? And what we found was, wow, yes, that turns out to be a gold mine of information. We can look at it, and we will, with several different drugs, but I want to just remind us that we're talking about youth. And for youth, the three most common drugs are alcohol, nicotine, and marijuana. So those are the questions that we asked. So we took that data, that 17,000 youth, 12 to 17, and we divided it into two groups. The people who said yes in the past month, they used marijuana. Nothing about quantity or anything like that. Just yes, I used marijuana in the past month. And the other group of 12 to 17-year-olds were people who said, no, I did not use any marijuana in the past month. And that's the only distinction between these two groups of people that we looked at. And then we looked at within those groups, the people who did not use any marijuana and the people that did, and we saw how much of other drugs did they use. Did they drink alcohol? Did they use nicotine? And did they use other drugs? And what we saw was if they said, no, I didn't use any marijuana in the past month, then their risk of using other substances was really low. So if you look at it as a bar graph, they're these little teeny bars because they were very unlikely to use other drugs. But when you looked at that a second group, which is the 12 to 17-year-olds who said, yes, I did use marijuana in the past month, the bars are much bigger. They're much more likely to be using alcohol, to be using nicotine, and to be using other drugs. And they're really dramatically more likely to use alcohol in the scary ways that we worry about with kids, like binge drinking, which is 5 or more drinks in one setting, or heavy alcohol use, which is repeat binge drinking. So there's this very clear correlation between the use of marijuana and the use of all those other substances. So then we said, well, is that just true for marijuana? Is that something that's unique to that? So we looked at that same big group again, that 17,000, but this time we divided it into the two different categories. One were the kids who said, no, I didn't use any alcohol in the past month. And the other group is the 12 to 17-year-olds who said, yes, I did use alcohol in the past month. This time we did divide it a little bit more. There was some more data to use. So we did divide it by people who used any alcohol versus the people who said binge drinking and the people who were heavy alcohol users. But the main key is the division between the non-use, no alcohol use and the yes alcohol use. And when you look at those students who said, I did not use any alcohol in the past month, little tiny bars, which means they're very unlikely to have used other substances. But the students who said, yes, I did use alcohol in the past month were much more likely to be using other substances, marijuana, nicotine, and all other drugs that could be opioids or stimulants or anything like that. And so if you just visualize it, you can just glance at it and see little bars, unlikely to use other substances if they haven't used any alcohol, and wow, much more likely to use substances with any alcohol in the past month. And so we said, let's keep going with this. Let's look some more. And so we looked at nicotine, and it held exactly the same. So if they did not use any nicotine in the past month, they were unlikely to be using any other substances. But if they did use nicotine in the past month, they were much more likely to use those other substances. And these are really dramatic differences in each of these categories. These aren't like, oh, well, I guess it's statistically significant, but what does it really mean in real life? You know how sometimes science is like that, and you're like, I don't see how this really correlates to real life. No, this data is kind of in your face data that really shows, wow, there is a direct correlation. And what this means is that people are making the choice to use. And once they make the choice to use one drug, any drug, they are much more likely to be using other drugs. They have all of a sudden a whole range of other questions, like when to use, in what situations to use, with which people do I use, what substances do I use, what quantities do I use, all those questions. But the students who've made that choice not to use, they're done. They've done it. They've made the choice. And that's why we call it one choice. It's that one choice. Are you going to be someone who uses, or are you going to be someone who doesn't use? And this is kind of usually where I get to the point that when I'm talking to a live audience, people are like, well, that's nice from a kind of idealistic standpoint. But seriously, most high school students use, and most, it's just normal for them to use. So I'm not sure who these random outliers you're talking about are, that are these people who are not using. And sure, maybe they're just at home. I don't know what the negative stereotype would be, that they're just at home being socially isolated and lonely, and that's why they don't use any of their substances. And so that's when I'm like, oh no, we have more data to show you.
Yes. Before we jump into that data, is this data that you were talking about available on your website, or where can listeners see this in your face data?
It is 100% available on our website. So you can go to our IBH website, ibhinc.org, or you can go to our One Choice Prevention website, which is onechoiceprevention.org. And both places, it's available to you. And as a matter of fact, it's not just available. We want you to use it. We are excited to have you use it. And we have what's called a One Choice community, where you can actually join this community and be part of it and get this information to use in whatever your prevention program is, whatever you're already doing, all the hard work that you're already doing. We're not replacing that. We're like, here, have this data to help you, have this messaging to help you in the great work that you're doing. And we'll even put your logo on it.
Marvelous. All right, listeners, I will put links to both of those websites in the show notes so you can go see the visuals that go with this data. And I'll tell you what, you need to go see it because it is very much in your face. But like you said, Carolyn, we're not talking about the outliers that are choosing not to use. So let's talk about that. Let's talk about youth substance use is not inevitable.
Amen. That's exactly right. And our job is to normalize not use. And we've got some data that makes that very, very clear. Let's think about the two questions. One, in the lifetime of a high school senior in the United States, has that person ever used any drug in his or her lifetime? That's the question. Now, not many people know that the peak of adolescent drug use in this country was 1983. A long time ago was when drug use peaked in the United States. And in that year, 3% of high school seniors had never used any drug in their lifetime. No cigarettes, no alcohol, no marijuana, no other drugs. 3%. 97% had used. Now let's go forward to the current data. Now it's 31%. So that never use anything in their lifetimes over that 4 decades went from 3% to 31%. That is a huge trend. And it wasn't bumpy. It was a steady growth over 4 decades. Now let's think about it again. And now we're not going to ask the question, have they ever used in their life? We're going to ask the question, have you used in the last 30 days? And in the last 30 days, Back in 83, it was 16% who had not used. 84% had used one of these drugs in the last 30 days. Last year, that number was 59%. That is a stupendous change, and it has not been recognized in the United States. We lament, and for good reason, the drug use is still a problem, but we miss the fact that there has been a tremendous growth in the youth who have decided not to use one. In other words, the people who've made the one choice.
One of the things I think is really helpful about this when talking to adults is a lot of the adults in the room, whether they're parents or, again, physicians, teachers, prevention educators, they actually were in school during that peak of teen substance use. And so when they think teen substance use is normal and it's inevitable, it's because that was their lived experience. But it's just simply not the case for today's modern student.
I'm curious, what caused that turning point in 83?
Oh my God. Many of you will be thinking, why did that happen in 1983? We had a sea change in youth drug use in the United States that was called the parents' movement. And Nancy Reagan picked it up with the Just Say No in 1981, but it had actually started in 1978, and it took tremendous hold in a very dramatic way. So a very simple statistic that is pretty amazing. People all say, Just Say No didn't work. And that's wrong. And Just Say No wasn't all about it. It was a parents' movement. It was much bigger than Nancy Reagan. And it started before her, and it lasted after she was gone. But what it had to do with was focusing on teen drug use, and it had a profound effect. So marijuana use by teens dropped 62% between 1983 and 1994. It dropped 62%. That was a dramatic drop, and it had other effects. And we're going to talk some more about that. But it was a very big thing that happened in the United States. And it was bipartisan. It had nothing to do with politics whatsoever.
Well, I'm glad I asked. And I was just going to crack a joke and say that turning point was because I was born in 1983.
Just proving that the adults in the room did not all go to school in the 80s.
Me, adult, questionable. I totally got a sidetracked there.
Not at all, because go to the next slide and you'll see why it's not sidetracked.
Okay, let's get a little bit bigger frame of reference and not just talk about marijuana as I was a minute ago. Let's look at all teen drug use in the United States and think about what has happened with that. And if you just look at alcohol, because alcohol has always been the most commonly used drugs, go back to that period of 1983, around there, 72% of American high school seniors had used alcohol in the last month, 72%. Last year, that number was 40%. And it's a steady decline over that period of time. Again, these are not statistics you'll see what's going on, but the alcohol number is very dramatic. Cigarettes have had a similar kind of decline over that time, except they were pretty steady for many years. And then the lawsuits to do with cigarettes came in, and there was a lot of money suddenly put into prevention programs for cigarettes. And that number went down very dramatically after 95, 96, and has gone down very dramatically. It used to be 40%. Now it's less than 10%. That's a huge success in the United States. Now, the marijuana number is more interesting and more complicated. It peaked at the same time. They all peaked at the same time, that 79 to 83 period of time. But it went down very dramatic, as I said, to 1995, and then it bounced up. And since that time, it's been going fairly level. It's steady, but it's steady now at half of what it was in 1983, the marijuana number, just marijuana number. But marijuana, because it's been steady, while cigarettes have been going down, marijuana passed cigarettes in teen use, high school senior use, in about 2010. But if you look at what's happening in the future, marijuana is on a path within the next few years to pass alcohol in the United States, because marijuana is on a different path than the other drugs. Not to go up very much, a little bit up, but not much. But what's different is both the cigarettes and the alcohol numbers are dramatically coming down.
More just in your face data that folks go to the website, look at it. It is just right there, undisputable.
One of the things I love about this too is that it shows that prevention education really works and public policy really works. You can sometimes feel like we're salmon swimming upstream. I mean, it just seems desperate situation. The tragedies we hear, the really horrible situations we see with lives lost in accidents or to overdoses are really disheartening. And it can just feel like we're the only people out here kind of trying to make a difference in the world in terms of teen health with substance use. And actually, when you look at this, you're like, wait a second, it's been working all the way along. It is working. What we do with prevention and policy really makes a difference, and it's saving lives.
And I'll send out a big amen to that as well. You mentioned marijuana is on a different path. What would be your response if I threw out the terms commercialized recreational pharmacology?
Now, this is a way to describe what the whole drug experience is. Drugs are chemicals that produce brain reward. They trick the brain and hijack the brain's normal, healthy reward system with superstimulation. And people like that, and they pay for that. And there's a whole industry, or industries, both legal and illegal, to provide drugs. You can see that with alcohol and tobacco and marijuana now as it's become legal. And you also see it with illegal things. But in all cases, it's driven by the user's money. So it's paid for it. And in every case, it targets disadvantaged population, minorities, and youth, because that's where the money is in it. So I think it's useful to step back and think about this drug problem and what it really is. It's using chemicals that hijack the brain's reward system for pleasure. And it is driven by the money of the users. And it has these characteristics that we saw with cigarettes. You see it with alcohol, you see it with marijuana, and you see it with the other drugs. And that's the concept of commercialized recreational pharmacology.
I also think it's interesting to think about why is it those big three? The difference between those and perhaps other drugs is that they are legal for recreational use for people over the age of 21, at least in some places or many places, and they have a low perceived harm to people. And those are the things that make use go up. If it's easily available and it has a low perceived harm. And that's one of the reasons that we see that situation with marijuana having really changed, is it's more available now, and also that there's that shift of seeing it as a less harmful drug. And that is a very slippery slope for a lot of reasons. But one of the reasons is going back to our one choice data and showing that if you're using one substance, you're really very likely to be using other substances. So you can't really rest on your laurels and say, oh, I'm not really worried about my child because they're just drinking a little beer or they're just smoking a little pot, because the chances are good, unfortunately, that that's not going to stay with that one substance, but it's likely to spread into those other easily accessible substances and then further.
Absolutely. And, talking about the drugs hijacking the brain's reward system, how does this tie into mental health?
So we only have one brain. It is all connected. And so I think that is really important. We have a phrase that we like to say, that there is no situation that drugs and alcohol cannot make worse. And that is never so true as it is with mental health. Mental health is something that is really in a crisis in our country, and people are obviously rightly extremely concerned about the mental health of our youth. And there are a lot of ways that people are working hard to make sure that youth have access to treatment and access to therapy. But we need to make sure that we think about what are the things that are negatively impacting that person's mental health. And one of the things is substance use. Substance use is correlated with worsening mental health disorders, whether that's depression, anxiety, or psychosis. And Then it goes the other way. Substance use disorders are correlated with worsening mental health. So they are feeding on each other and making both of those illnesses worse over time.
Side note, this is a bone I pick with a lot of veteran organizations. So being a combat veteran who had post-traumatic stress, traumatic brain injury, all of that, and led me to drinking. When I would want to get involved with veteran organizations for that support, they wanted to get together and go drink. Let's go do a fundraiser for suicide prevention for veterans, and we'll go on this bar crawl.
I think that is such a good point. It also is a problem in our society that we equate fun, party, having a good time with substance use, particularly drinking. And that's really a shame because there are a lot of other ways to have fun and a lot of other ways to connect with other people. And so the more we can disentangle that in our society, in our language, the better off we are. And also you think about what we're modeling for our youth. So because they're watching what the adults are doing. And so if the adults are saying, I've had a rough week, I can't wait to drink, or I can't wait to go out with my friends and party, they're picking up on all that language and that behavior. And what do you think they're going to do?
Mm-hmm. Absolutely. And actually, Dr. Alex Elswick out of the University of Kentucky was on another podcast with me, and he just broke it down as simple as we need to make life without drugs more desirable than life with drugs.
Yeah, but there's a problem with that. The drugs have an advantage because of the hijacking of the brain, and you can't get away from that. I don't care whether you're happy or sad; they're going to have that effect, and they're dangerous. There's no question about it. The brain is not built for drugs. Drugs are a human invention and fairly recent human invention, and we don't have any biological protection from it.
I think one of the things that is helpful when you're thinking about prevention is thinking about the dangers of that hijacked brain, of that commercialized recreational pharmacology, where humans who are trying to make money have put a lot of effort into developing stronger, better, faster drugs that are going to go to that pleasure center of the brain and give you that big bang for your buck. And that's really scary. That should frighten you. It should frighten you that there are people that are making money off of creating substances that are going to hijack your brain and take away your normal senses of pleasure, the things that normally would make you happy, being with your friends, playing a game, being successful in school. All those things that bring us that kind of natural joy are going to be paling in comparison to that artificial happiness that a substance can deliver to you in an instant. And so I often think when I'm talking about primary prevention, you don't want to give your brain the opportunity to learn about that artificial stimulation. And so back when I was a kid, I was a one-choice kid. It was a way before this, but we've talked about the fact that I learned about this from my father at the dining room table when I was very young. So I was thinking about these things, and I had friends that would say to me, why don't you drink? How do you know? You might like it if you tried it. And I would say, look, that's the scariest thing you could say to me. That's the most convincing thing you could say to me, because I don't want to find out if I would like it, because that means that substance is going to be controlling my brain and controlling my choices. And I don't want that for myself. So that, I feel like that's like a message that people early can make. But then anytime along the continuum, you can make one choice for your health. And I think that's one of the things that we're saying is that it can be one choice for someone that I'm talking about who is never used. Maybe you're talking to a young audience, elementary school, middle school kids. You're talking to people who've never used. But it can also be for teens who have made some choices to use in the past, but now you're giving them information. You're giving them the data and the science about brain protection that they can really make smarter, better choices for themselves. They can start wearing their seatbelt. They can start wearing their bicycle helmet, and they can make the active choice not to use. And then one choice is completely compatible with people who are in early or long-term recovery. It's that choice, I'm not going to use any of these substances for reasons of health. I'm making that choice for my future.
And also, when Bill Wilson started AA, he had what's called singleness of purpose. He just talked about alcohol. He didn't talk about drugs at all. That's why we got NA in there, because of that. And it took decades for AA to figure out that recovery doesn't just mean not using alcohol. It means not using other drugs. And the drug experts in this field, Dave, are all around single substances. They view it as all our treatments are substance specific, all the medications, but we don't have substance specific patients. They don't do that. And that's why recovery is not substance specific.
I once heard somebody say, I'm going to rack my brain to try to remember who it was. They said sometimes in prevention, we spend too much time talking about the drug itself and not enough time talking about the people, the individual. Get so laser focused on that one single substance that we don't look at the big picture.
I think that's so important, because if you're just talking about a single drug, and then you're going to be like, oh, wait, we need to talk about this other drug, you're essentially playing whack-a-mole with like, now this is the problem. No, this is the problem. And really, again, that's where we get this one choice, because what we realize is that we can't keep up. So cigarettes are a really good example of this. Bob showed us that data, how the cigarette use had come all the way down to, I think, about 5% of high school seniors had ever used cigarettes. And that is, fantastic. That's a really low number. And then what happened was, the vape pen, the e-cigarettes came onto the market and just blew us all out of the water. We didn't see it coming. That new delivery device of nicotine that people kind of touted as being safer and not having the same carcinogens perhaps as smoked nicotine. And it just, boom, the numbers of high school students using nicotine went way up. And that invention of a new drug, a new delivery method, a new way of using is happening all the time. So if we're just focused on one thing, if we're just focused on alcohol, or we're talking about smoked marijuana and we're not talking about cannabis products that are used in other forms, we're going to miss the issue here. And that's why we think this lens of one choice can be so useful, because it's really boiling it down to, again, that question, am I choosing to be someone who uses, or am I choosing to be someone who does not use? And that not use decision is really the choice for your future and for your health. And we want to put that information into the teens' hands in a powerful way, because they already know this. And again, that goes with that data. We have a third almost of high school seniors who have never used any substances in their life, and 60% who haven't used in the past month. They're already living this one choice, whether they call it that or not. They're already making that healthy choice for themselves. And so one of the things that we have done in making, I talked about how we've made all of this material available to prevention programs all over the country and all over the world, is we've said, put this in the hands of your student leaders. It's all well and good to hear it from adults like us, but you can hear it from the students themselves who are making one choice for their health. And they are really powerful. So one of the things that we've had a bunch of schools and organizations do is a mosaic wall. And this is where you take these colorful paper tiles, we call them, that say, I make one choice to be drug-free because. And then it allows a person anonymously to write what their why is, what their reason is that they are making the one choice not to use. And people say all sorts of things. They might say, I have a family history and I don't want to get involved in that. They might say, I'm an athlete and I want my body to be in peak condition. They might say, I dream to be a neurosurgeon or an astronaut, and I want to make sure that I, am achieving all my educational desires. Everybody's reason is personal. It boils down to the individual, that person, like you were saying, that we stop talking about the drug and talk about the person. What do you want for your future? Why are you making one choice to be drug-free? And then the students write those things up and you can put them on a big display wall. And not only is it powerful for the students that do it, it's then powerful for the students that see it, where they realize they're not alone. Because people who choose not to use can often feel like they are kind of alone. They hear all the people talking about use. It turns out that people who use are much more vocal about it than the people who don't use. And so they might think, I don't know, I think I'm kind of an oddball not using, and not realize that in their very community, in their school, in their neighborhood, in their area, there are a lot of students who are making one choice for a variety of really good, exciting reasons. So that's just one example of like an easy, low-cost way to start incorporating this concept into your own community and really supporting the normalization of non-use.
Mm-hmm. Absolutely. Normalizing non-use like you had shared before. And I have a feeling that there's probably a picture or two of one of those mosaic walls on your website or social media streams. Yeah.
There's a million pictures. It's so great. It's one of our favorite things. It's so exciting to see what people have done. And so we have all these examples of people all across, again, the country and the world who have done these mosaic walls. And they're very colorful. They're very, cheerful, very positive. And that's one of the things about our prevention messaging, is that it is positive, it is hopeful, and it's really showing the youth of today that they're making smart choices. They as a group are making smart choices and doing a good job of protecting their wellness and their brain and their future. And so this is a really just a fun way to show that, but also very poignant to see and to realize, wow, this is a movement, and this is a growing movement, and these kids are our teachers. They're our leaders. Put the microphone in their hand.
Yes. Oh, and I'll put a link to some of those examples on social media in the show notes, listeners. But what are some other examples that prevention groups are doing with One Choice?
Another one I really like is several organizations have done video public service messages for their own communities. And it's similar to the mosaic wall, but this one is not anonymous. This one is individuals who are comfortable speaking. And they are making videos taking our data, this same One Choice data, but presenting it in their own voice to their own community, their own school or their own area, their parents in their community. And I always laugh because I think I do a really good job if I can, get through all of this information in, 30 minutes or something like that. And these kids can, put it in a 2-minute video, and they do a much better job. So that's another thing that I'd love to do, is just go hit one of those videos, go play one of those videos, and let the kids tell you in their own words how this has impacted them and their choice for themselves.
And podcast listeners, I got to shout out Drug Free Australia. They were on the show back in June to talk about their Save Your Brain initiative, their program there. So I'll drop that link and a link to their website as well, so you can see how they have adapted, how they have embraced One Choice.
That's a really great point. They were early adopters of One Choice, and again, One Choice is our language. You don't have to use that. You can use anything, like Save Your Brain is fantastic. We love it. This is information that we are putting out there for you to use in any way that's helpful for your organization. And in fact, if you've got a great idea, we want to know about it. One of the things that we did, for example, was we heard from our community members that they wanted a handout. They're like, I need something that I can hand out at a parents' night. So we made a trifold handout that had all this information on it. And then someone else is like, yeah, that's beautiful. It's gorgeous, but I can't afford to print that for enough people. I need a digital copy. So we said, great. Then we made a 1-page digital copy that you could link for people. So if you've got a great idea, and you're like, they're not doing this, they don't have this, we want to do it. So we want to hear what you've done. We want to share what you've done and celebrate what you've done. And then we also want to provide for you if you've got something, some idea of something that we can do to help get this information out there in an exciting and interactive way. We would be thrilled.
Yes. First off, the Mosaic, the Save Your Brain, some great examples on how prevention groups have translated this into action. What kind of support and resources do you have available for our listeners that want to adopt and put this into action in their local community?
First of all, just get in touch with us. Go on our website, onechoiceprevention.org. Look at the pictures of the mosaic wall. Look at the videos that these teens from other communities have put together. You can download our pamphlets and our handouts and all that sort of thing. And then reach out to us or reach out to some of our organizations that you'll see listed on there and start bouncing ideas around, because prevention, we really are all trying to achieve the same thing. We're not actually competitive with each other. We want to support each other and enhance the work that everybody is doing, because prevention is really local. It's really something that each community is doing. Oh, one of the things that we also have, which I think is really helpful, if you're interested in that data that we have, but you're not sure if it's right for your community, like I'm not sure that's true in our community. Do we really have a lot of non-users like that? Because I don't see that. We have a tool on our website where you can use your local data and put it through this lens to come up with your own data. And we've had a lot of communities do that. And in fact, what it's shown is that their community data is very similar to the national data. And that's really exciting, because it's cool to see the national data, but it's even cooler to see it with your own data.
I just want to go play around with that now. There goes my afternoon. I'm going to be digging into the data. Wonderful. Talk about some great resources, And I've just got to say it again, because you said it, but I want to make sure our listeners heard it, that all prevention is local.
I think it really is. It really is local. And I think it can be even individual to individual. It couldn't be one-on-one. And one of the things is prevention is not like we had one class on prevention or even one section in school in X grade on prevention. That's not how it works. Health standards aren't like that. We don't tell people one point that you should eat healthy food. We talk throughout their education about healthy food and what does healthy food mean and what does that look like, and then how does that work for you? What is healthy food eating for you, and what are your challenges? What are the challenges that you face because of what your family eats or what your resources are? And so these kind of individual conversations really enrich prevention, and again help an individual incorporate this concept for themselves. I am making this choice for myself because I care about my wellness and my future.
Absolutely. And one of the things that helped this click for me was related to my own experience and knowledge around fitness, like exercising, lifting weights, running. And oftentimes you'll set a goal. Oh, I want to lose 10 pounds. Great. Or, oh, I want to run a 5K or a half marathon. You achieve that goal. Great. Then what? And when I started to shift my thinking to, I want to be fit for life, that changes the whole game, the whole approach. It's about creating norms, healthy norms, routines, habits that foster a healthy life. It's not, oh, I have to chase these numbers in the gym or on the scale. That when I connected the dots there, empowered me and just changed the game for me.
I think that's such a good point. I had a fitness coach I heard one time say, if you've had a rough day, you deserve a good workout. So it's not that you have to go work out, but that you get to go work out. And that's is a reward for yourself in a really powerful way. And I think that that's the thing, again, also with One Choice, is it's not just that you're depriving yourself of it. You're not saying, oh, I guess I won't use because I'm scared of the law, or I'm scared of bad outcomes happening, or I'm scared I'm going to get in trouble with my mom, or whatever that is. But actually, it's an active decision. I am making this choice. And that's why that mosaic wall says, I make one choice. It's your decision for your wellness, whether you're going to exercise and whether you're going to abstain from substances while your brain is developing.
Yes, I I love it. I love it. We've been chatting for quite some time, and I opened up this episode with, I would love to have an infinite amount of time with both of you so I could pull out and tease out more and more of that wisdom. But I know our listeners are busy as well as you are. So just want to open it up. Any kind of closing thoughts or wisdom you'd like to leave our listeners with as we wrap up this episode?
Well, I think that drug use is brain abuse. And what you were talking about, for example, exercising, is using your healthy body and your life in positive ways. And that is really what we're talking about, is the chemical abuse of the brain that is very, very destructive at the beginning, but has a very long-term negative impact. Whereas the things you're talking about, healthy eating and exercise and those things, are exactly the opposite. They're using your body in healthy ways that are sustainable. And at no point in the history of the world have there been so many temptations, commercially exploited temptations to do things that are unhealthy, but it's also never been a time to have more opportunities to make healthy choices.
Yes, so many opportunities to make those healthy choices. Caroline, what you got for us? What are you thinking over there?
I'm thinking about how someone might be listening to this and still thinking, yeah, I've listened to that. I've checked it off my list. Now I'm going to go about my life. And I want to think about how to remind people to make a few choices right now, to make a few decisions right now about how you can incorporate this information into what you're doing, what you're already doing, not to change what you're doing, but just to have this enhance or add to or be another tool in your toolbox of prevention. And so I really invite you, again, to go on our website, to look at these graphs, to really get into that data and understand what it means, to see what students have said and what other organizations have done, and to really pick one or two ways that you think that this could be effective in the work that you do. And so part of that is remembering the core parts of One Choice and remembering that it's really a positive message, and it's a message of hope and optimism, and can be used to encourage and support teens in the healthy choices that they're making in their lives. So One Choice is about knowing that science of the developing brain, that anything that happens to that brain while it's still developing can have a really big impact on it. So we want to protect it. Understanding that data that for all substance use is related. So when a teen makes the choice to use one substance, they're at now very high risk of using other substances. And so even if your prevention program is like, well, our mandate is to stop teens from smoking, or our mandate is to stop drinking and driving, that's fantastic. You do that. That's amazing work you're doing. But you can incorporate One Choice, and you can use that opportunity to say, and one of the concerns is that if they're drinking or they're smoking, they're also likely to be using these other substances. And all of that is going to have that impact on that developing brain. And then the third part is really holding strong to understanding that trend, that there are a lot of students in your community who are not using. And if you find them, you may find your very best allies in supporting your prevention messaging. So if you give them the opportunity to lead, they are really inspiring.
Absolutely. So listeners, did you catch your homework assignments? So you have two. One being visit the One Choice website. Link will be in the show notes. And two, think about one or two things that you can do to start incorporating One Choice into your current efforts. All right, Dr. DuPont and Dr. DuPont, it has been an absolute honor to sit in the same room as you and have this conversation. And I look forward to continuing to spread the message of One Choice and talking with you both again in the future. Thank you very much.
Thank you so much for having us. It's been a pleasure.
That concludes this episode. Thanks for tuning in. Be sure to hit the subscribe button and share this episode with a friend before you leave. And we look forward to seeing you on social media because prevention is better together. Together, we are stronger.